Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Benin State map out strategies to check scourge of sexual and gender-based violence after reports of shocking rise during the coronavirus lockdown. Kaduna State government launches social protection policy to mitigate the impact of COVID-19. And Ghana becomes the first country to receive coronavirus vaccines through the COVAX sharing initiative. The Nigeria Center for Disease Control, NCDC, is reporting a similar trend in the number of coronavirus cases since last Friday, and that's below the 700 daily tally. What does this suggest? We're not quite sure, but we'll find out later in the program from our experts. However, 571 new confirmed cases and 12 deaths were recorded last night, putting to date the total caseload at 153,187 cases. The new cases are reported from 20 states and the Federal Capital Territory. Meanwhile, 130,034 cases have been recovered, says the agency, including 214 community recoveries in Lagos, 61 in the FCT, and 11 in Benin State. The center has also added the Ondo State Public Health Laboratory to the NCDC Molecular Lab Network, making it about 27 open PCR and gene expert laboratories where you can test for free, while there are also 40 private fee-paying labs and 7 corporate labs with capacity to test for the coronavirus in the country. Thus far, total samples tested is less than 1.5 million. Now, following the sharp increase in the figures of sexual and gender-based violence during the peak of the coronavirus pandemic's first wave, in a bid to ensure that it doesn't reoccur this second wave, the Benin State government is setting up a steering committee on sexual and gender-based violence, with the First Lady leading the charge to sustain the efforts and review of relevant laws to help curb violence against women, men, and children.
There were widespread reports of sexual and gender-based violence during 1 month of lockdown, with some cases leading to grievous body injuries and even death. According to the United Nations Women's Report of 2020, a research conducted in 23 states exposed a sharp rise from 30% in March to 149% in April 2020. The Benin State Steering Committee on Gender-Based Violence, led by wife of the governor, is advocating sustained efforts and review of processes that will guarantee safety for all.
We need to see how we can move forward. And as a team, there is every need for us to review our implementation strategy for better targeted and coordinated interventions, which would be implemented with the best efficient use of resources and which would yield the much needed positive impacts.
A lot of people are unaware of the provisions of the law. So we need to conduct sensitization on the VAP law and other laws that would help to curb GBV.
The meeting goes into a technical session with participants identifying reasons for and mapping out strategies to help check the scourge of SGBV.
There was a whole rise in the rate of gender-based violence. What should be done about it? These are the things we're trying to do more advocacy, more education, more sensitization. And then the key thing should be to prosecute and punishment for those people that are erring, people that are propagating this violence against other people.
Before now, they probably had the opportunity to go to work, escape for a few hours before coming back, and probably everybody is tired. So the incidence of GBV is reduced. But with the lockdown, you are forced to be at home from morning, in fact, for 24 hours, and probably with your abuser.
The committee expects that steps will be taken with the support of the Benin State government that will help reduce the number of sexual and gender-based incidents in the state.
As part of efforts to address the socio-economic problems posed by the COVID-19 pandemic, Governor Nasser El-Rufai of Kaduna State has launched the state social protection policy for vulnerable people in the state, declaring that Nigeria has the highest number of poor people in the world. Speaking during the lunch held inside the Executive Council chamber of the State Government House, he says that his government will establish a social protection agency to ensure that all social protection programs are delivered in an integrated, inclusive and sustainable manner that optimizes resource utilization and achieves high impact.
The COVID-19 pandemic, with all its socio-economic disruptions, has shown us how much despair the poor and vulnerable go through on a daily basis. This policy is indicative of the unwavering resolve of the Kaduna State government to ensure a life of dignity for all its residents on the basis of right, not charity. To ensure the social protection is pursued in an inclusive and sustainable manner, this social protection policy will be supported by a social protection law to ensure that the government delivers on its promise. A well-articulated implementation plan and results framework have also been developed with the support of our development partners. In the coming weeks, a social protection agency will be established by government to ensure that all our social protection programs are delivered in an integrated, inclusive, and sustainable manner that optimizes resource utilization and achieves high impact.
And from Kaduna, we move over to a report released earlier in the week examining the findings of a household seroprevalence survey by the NCDC and the Nigeria Institute for Medical Research, NIMA, on the true number of people who may have contracted COVID-19 than figures from the national surveillance figures. Well, the surveys were conducted between September and October 2020 in 4 states. Well, joining us now is Professor Ehimario Igumbo. He's the Senior Epidemiology Advisor to the NCDC DG, Chair Scientific Advisory Group of the Nigeria COVID-19 Research Coalition, also Extraordinary Professor of Epidemiology, University Western Cape, Cape Town, South Africa. Thank you for joining us on the program.
Good evening. Thank you for having me on.
All right, Prof, first, does it really show that everyday confirmed figures by the NCDC is not a true picture of the number of cases across the country? I mean, especially for the states like Lagos, Enugu, and Nasarawa, where the survey was conducted.
Well, thanks, Millicent. Our surveys showed that we have quite high levels of coronavirus antibodies in the population in the states where we surveyed. This is not surprising. In fact, it was inkling of this that caused us to embark on this survey. And national surveillance systems are by design made to report cases that present in our testing facilities, or at best those that we actively capture. Now, given the fact that lots of the cases of COVID tend to be asymptomatic, people don't present to the clinics, facilities, and get tested, so we definitely would not be capturing them in numbers. And that coupled with, the rates of testing just the presentation of people to facilities means that our national surveillance systems will not always capture these numbers in the way that we would in surveys of this nature.
So essentially, in very clear terms, if we take Lagos, for example, instead of the over 54,000 cases that NCDC has recorded, that we know, it should have recorded over how many? 2 million, 4 million, maybe more?
Well, so the idea is that we would now do that extrapolation from some of this data. So initial estimates we found was that 1 in 5 people had antibodies for coronavirus, which means these people would have been exposed in a state like Lagos. So certainly we would need to look at how that plays out through the country. But there was quite some variation. Lagos had that in Gombe, where we had the survey, that proportion was 1 in 10. So would need to now go back and really look at how far off we really must have been from what's our surveillance data. One important thing to mention is that we've always taken our surveillance data as, the minimum cases that would have been, and they remain very relevant in checking the trend over time. And what we do with the surveys of this nature is to further characterize the epidemic.
Tell us a bit more about the process, how you arrived at this, the blood samples, and what other factors were characterized.
Right, thank you. So our objective was really to look at the population of Nigeria and find out what proportion of people living in the states we had selected had antibodies for coronavirus in their blood samples. So we selected 4 states, Enugu, Gombe, Nasarawa, and Lagos State. And in those states, we took households randomly selected. And in each of the households, we interviewed and collected blood samples on every single member and tested those samples in the lab for antibodies for COVID. And based on that, we're able to then estimate how many of them indeed had antibodies for coronavirus. We also asked them particular questions about their behaviors and some of the social demographic characteristics. And with that, we're able then to say what profiles of people had tended to be having more of the antibodies than others.
So in the report, it also says that antibody response according to severity of infection and the duration of its persistence are not yet completely understood. What exactly does that mean?
Right. So SARS-CoV-2 virus, the virus that causes COVID-19, is a virus that emerged barely a year ago, and we're still learning more about the antibodies. What we know is that people have had been reinfected even after initial infection. We also know a little bit that, the antibodies may not persist for very long in certain people who have had infection. Now, the surveys we did were conducted between September and October last year, which would have been 7-8 months from the first case that were identified. So we don't know how much of people who would have been infected early on in the epidemic would have actually lost antibodies by the time the survey was conducted. And indeed, since when we conducted the survey, the emergence of the second wave now, we can't say for sure that those who had antibodies in September, October last year and still have antibodies right now if we were to test them. So given this notion of seroreversion, as we call it, where you have antibodies and then you lose them over time, we really need to be very careful in interpreting the results of it.
In the final 1 minute that we have, does this survey give credence to the number of positive cases, fatalities from the virus in Africa being said to be higher than reported due to low testing, poor registration of deaths, do you think?
Well, on testing, so certainly more infections are likely to be present in our various populations than what our normal surveillance systems have been showing. But our survey did not broach on the subjects of fatality, so we can't really comment very concretely on the numbers of deaths. But perhaps, there are again, a bit of fatalities. But we must say that we found lots of asymptomatic or mild infection. So again, this would attenuate the levels of deaths that could have been expected in the population overall.
We'd like to thank you, Professor Ahim Mario Ugumbo. Thank you so much for joining us on the program, Senior Epidemiology Advisor to the NCDC Director General. Thank you for joining us.
Thank you for having me.
Still to come, Nigeria records over 60 deaths from COVID-19 complications in less than a week. Please join us again for more. Welcome back. Ghana has become the first country to receive the coronavirus vaccines through the COVAX Vaccine Sharing Initiative. The WHO program, COVAX, is seeking to ensure that vaccines are shared fairly among all nations. It's aiming to deliver about 2 billion doses of COVID-19 vaccines globally by the end of the year. A total of 600,000 doses of the vaccine developed by AstraZeneca and Oxford University and produced by the Serum Institute of India arrived in Ghana's capital, Accra, today. Fred Smith of Joy News Accra tells us how the vaccines were received.
The public is quite divided over whether to accept it or not, but in official circles, there's quite some excitement about this because there's a belief that we will be able to control the spread once we have vaccinated a good number of our population. And if you recall, in the Ashanti region alone, we're recording high number of deaths. And so that region this afternoon has held a news conference to say that they are excited about the arrival. That region is expected to receive about 2 million doses of the vaccine and to vaccinate its population. We have about 5 to 6 million population in the Ashanti region. So 2 million is right about 1/3 of that population. That region, the Greater Accra region and central regions, are those to benefit from the consignment that we've received today.
Back in Nigeria, the death toll from COVID-19 is still on the rise, with one of the highest daily toll, 23 deaths recorded on Monday. The latest figure of 12 deaths was recorded in 24 hours, while another 8 deaths was recorded on Sunday, which raised Nigeria's fatality toll to 1,862 as at the 22nd of February. Between Friday and Saturday, 18 people had lost their lives due to COVID-19. So far, about 61 fatalities have been recorded in the past 5 days. Nigeria joined the first wave from the first index case. It took about 2 months thereabout to record 58 deaths compared to the numbers in less than a week, clearly showing that a lot more people are dying due to COVID-19 complications. Well, to take a look at the vulnerable population and solutions, Dr. Hassan Sule is a public health physician. He joins us from Abuja studios. Thank you for joining us on the program.
Oh, thanks for having me.
Now, Doctor, the deaths are not abating, a fact which shows that we are not succeeding in keeping the virus far from the vulnerable in society. And why is this? And isn't it possible to record 0 deaths?
Oh, well, thank you for having me once again. The rate of increase or the spike in the numbers of deaths over the past few days is troubling when compared to the 2 months it took to get get deaths from index case to 58. There may be a number of possible reasons could account for this. Probably we're dealing with a more virulent strain of the virus, or that there is greater amount of spread to vulnerable people, and that's where the concern is. You know, the timelines for COVID-19 is taking over a year, and around August, from August to festive season last year, I mean, cases were low, transmission was low, but then it also meant that people might have let guards down, and during festive seasons, the festive season, there was a spike, which I believe we're still in. The spike probably, that letting our guards down probably would have resulted in a greater spread of the disease, and in absolute numbers, more vulnerable people coming in contact with the virus, and then more deaths. That's one aspect, and that's one perspective to it. The other being that, like I've already mentioned, we're probably dealing with a more virulent strain of the virus.
Dr. Sule, do you think that perhaps there is a good grasp on the messaging, and especially keeping the most vulnerable population safe until the vaccines arrive? Do you think?
I actually think averagely most people know more than average of what needs to be known about COVID-19. People tend to know it's a virus, and people, I believe, tend to know that it's fatal if there is a background illness. So I believe people know that. But what I think is driving this greater spread that we're seeing is people have become apathetic, a bit fatigued. People have seen that the disease wasn't as fatal as projections expected it to be, or projections cast it out to be. So that again, because we're human beings, that again would probably have influenced going soft on prevention and people just letting their guards down and not doing what we're supposed to do to prevent spread.
But looking at the recent coronavirus cases of below 700, the daily tally since last Friday, what can we say for sure is happening, briefly?
Yes, of course. Thankfully, there's been a decline from the spike we began to notice from last festive season. Cases, numbers are going down. But from the latest release from the NCDC, the seroprevalence of antibody studies they did, which showed that in a certain state in Nigeria, that is Lagos, which accounts for the majority of our cases, close to about a quarter of the people tested had antibodies for coronavirus. So that may give an inkling into the number of people who've had this virus. But I think our response is typical, because over 90% or around 95% of people who've had this virus would recover. So it's possible that people who have had the virus early on in 2020 and have developed antibodies have lost those antibodies and have come in contact with the virus again and now had those antibodies. So ultimately, the trends are coming down. It's showing that possibly there's a lot of positivity that's gone on in the society, and then people have lost antibodies. People have lost antibodies and have gained them and are not falling as sick and presenting to hospitals as it was during the festive period.
What a virus. Well, we'd like to thank you, Dr. Hassan Sule, public health physician. Thank you for joining us on the program.
Yeah, thank you very much.
The World Health Organization says the number of new coronavirus infections and deaths linked to the disease is continuing to fall. According to the Global Health Agency, 66,000 new deaths were reported last week, showing a 20% decline when compared with the previous week. Let's take a look at our global updates.
We begin with Malaysia, where Prime Minister Muhyiddin Yassin has been given the first shot of a COVID-19 vaccine as the country launches its inoculation program. Authorities hope the vaccination drive will rein in a spike in infections and help revive an economy that recorded its worst slump in over 2 decades last year. Malaysia has an ambitious target of vaccinating at least 80% of its 32 million people by February next year. France says the COVID situation is worrying in about 10 regional departments, including the Paris Île-de-France area around the capital, and that the government is ready to take extra measures to limit infections. The observation was made by government spokesman Gabriel Attal. The Alpes-Maritimes Mediterranean coastal region around Nice on Monday announced a partial lockdown over the next 2 weekends. The government says it is doing all it can to avoid a new national lockdown. Thailand has received its first 200,000 doses of the Sinovac Biotech CoronaVac, the country's first batch of coronavirus vaccines, with inoculations set to begin in a few days. Most of the doses have been reserved for frontline medical workers. According to the Health Minister, Anutin Chandrabkar, 117,000 doses of AstraZeneca COVID vaccine would also arrive today, and that Prime Minister Prayuth Chan-o-cha would be among the first recipients.
Don't let down your guard. Continue to take responsibility. Visit our website, channelstv.com, for more updates, a better understanding of the pandemic and the latest trends. You also have other stories on politics, business, and sports at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.